Otherwise, it's just me. But the reason why I brought Amber here to hang out with us is because I'm in garage, okay? And I did a couple of these. Oh, there she is.
Hi.
Hi, Amber, I'm gonna make you co-host. Okay, so everybody, I'm so excited because I tried. So Amber and I had in Amber. Is it okay if I share how we met?
Oh yeah, of course.
Okay, so Amber and I met in October. We did ayahuasca together, and Amber was somebody that I definitely connected to, and so I sent her a message. We kept in contact, and I sent her a message, and she was all, "Oh yeah, your fascia, is still holding on to something." I can't remember exactly what she said, and I was like, "What do you mean by is holding on to the trauma?" I think that's what you said, and she goes, "Yeah, and she introduced me to Human Garage. Okay, I hope I'm saying it right." And I was like, I sent her a message back, and I'm like, I don't know if I have this right. Human Garage. And then the craziest thing is, so I think some of you know I'm working with Craig Conant. He sent me a message and he was like, "You've got to check out Human Garage." So I'm so excited to introduce you to Amber. And Amber, I apologize for being a little bit late. I was on a master class beforehand. So I'm going to let Amber just kind of jump in, and then I'm going to give you her bio, and she's got some special opportunities for you. So Amber, you're up.
Okay, great. I'm so excited to get to hang out with you guys today and kind of introduce you to the Human Garage. And so it's called the Human Garage because that's where they started their business. So they used to be based in LA and worked out of their garage, and then they've shifted to like teaching people these practices. So I'm a massage therapist, a movement and yoga teacher, a shaman, a Reiki master. So I love learning. I love all the things and how the things start to integrate and weave together for us. And hopefully, if you came to see me as a client, I hope that we can work together and you can heal enough that at some point you stop coming to see me as a client, and then maybe we're just friends and we stay in community together. So I posted in the notes what we're going to go through. The Human Garage is a great program. They have a free app that you can download, and they do 1, 3, 7, 21, 28 day practices. So there's just tons of information out there. All the videos are also on YouTube. So I would recommend just copying that out of the notes. Maybe make another notepad thing for you that you can add your own notes into about what moves feel good for you, what ones you might have questions about. And I know we only have an hour, so I want to introduce you to some moves. If you have questions, please post those in the questions, and then maybe Mary Lou can interject when things come up. So my first question is, how many of you guys have heard about fascia? And I can only, okay, I see a few hands. Great. And so fascia is like an organ system that has not been yet recognized as such. And so the fascia runs under the skin, through the muscles, around and through the organs. And I like to kind of look at it kind of like dough, kind of like saran wrap, and kind of like water. And so what do I mean by that? So like dough, it takes some time to knead and to warm up. So we can't just pull it one time and we get pizza, right? So we have to be gentle with it. And once it starts to warm up, it starts to change. And so it's also like saran wrap in that we have many layers of it and it can kind of get stuck together. So some of us know once that saran wrap gets stuck, we can't just easily rip it back open. So it's also like water in that it changes consistency. So it might start to harden up. So we hear this as frozen shoulder, or sometimes in the morning we get up and we're a little bit tight or achy from being in a position all night. And then once we start to move, things start to shift. We start to warm up, it starts to melt. We also see this as, say I was working in the garden for many hours. So I've warmed up, I've moved around a lot, and then once we start to cool down, things start to happen. We might also see this if I sat in a car or an airplane for a long time, right? We start to get held in different positions. So all of us have these patterns of just living life. So Mary Lou also mentioned the trauma piece. And so we all have some sort of experience in our life that we are processing through our body and through our vessel. And so most of us know, like intellectually, we understand what's happened, right? We don't need more of the intellectual stuff. We need it to get into our nervous system, into our body. And so that's where this reprogramming kind of comes in below the mind. So it helps us deal with our experience in a way that is gentle. And so that piece is a big shift for me, having come from this old, Protestant work ethic, this American, I'm gonna pull myself up by my bootstraps. As a female, I gotta do it better, faster than the men that I worked with. And so for me, one of the shifts has been, I can work hard when I need to, but I don't need to work hard all the time. This abundance shift that we're making, it can be easy, it can be enjoyable, and I don't need to punish my body for all the support that it's given me through my life experience. Okay, so in the notes I put walk in a figure 8. So walking is one of the most complex actions that the body does. So that's one way where we can check in with our nervous system and the neural muscular connections. So if you have space to do this walk, you can incorporate it, or you can just try it after we get off of this call. So I have posted all of the fascial maneuvers. We'll go through some of them. In a normal practice, I would maybe do a 15 or 20 minute practice in the morning and in the evening. And so at the end, we'll do the organ reset, which is something that's really nice to do in bed or if you're relaxing. And so we'll get to that. All right. So I just want to do a couple with you, and then let's see if you guys have questions, and then we'll keep going. So I'm out here in my outdoor massage office space, and so I am, see if we can get most of my body in here. So I'm barefoot on the earth. Being barefoot helps us ground. We're electromagnetic beings, so being able to ground excess energy to the earth is easy and helpful. So houses have grounding cords, and it helps us just discharge excess energy back to the earth to be recycled. So I like to think like sending it to the compost pile, right? Like it can come back. So we're gonna start with totally twisted, which is one of the main ones that I would do every day. So I'm taking my left foot and my left hand and stepping it over the right. And you can also do this seated. So my left hand's coming to my right armpit, and then my right hand's coming on top. So this is a great one you can do at the office in a plane. Okay, I'm gonna turn my body one direction, and I'm gonna turn my head the other direction. And then I'm gonna breathe in and out through my nose a few times. So we'll do 3 rounds in and out through the nose. And then we're gonna switch to in and out through the mouth. One more, in and out through the mouth. Okay, then slowly, gently, we're gonna keep the hands and legs. I'm gonna rotate back through center. Head goes the other direction. And again, in and out through the nose 3 times. Notice how breathing through the nose, the pressure is a little bit higher up in the body. And then I'm gonna shift to 3, in and out through the mouth. Can you feel that in and out through the mouth go a little bit deeper down into your torso, into your belly? Okay, and then slowly, gently, because the fascia likes to move slow, back to center, unwind, let it go. So as we hold, it's like we're kind of wringing out the system. And so you might notice the body trying to wiggle, trying to move, that energy's trying to move out of the body. Okay, so we're coming to the other side. So right foot's crossing over the left ankle, right hand's coming to the left armpit, left hand's coming to the right shoulder. Twist the body one way, twist the head the other way. 3 rounds of breath, in and out through the nose. And then switching 3 rounds in and out through the mouth. As we stay, you might be able to twist your body a little bit more to one side, head a little bit more in the other direction. Okay, then slowly, gently come back through center. Body twists the other way, head twists and looks over the shoulder. In and out through the nose 3 times. And then when you're ready, 3 rounds in and out through the mouth 3 times. Slowly, gently, come back through center, let that go. If you have space to walk around, take a little walk. Otherwise, you can just give it a little shake. Okay, the next one that we're gonna do is called anti-gravity. So this is really good for helping get to sleep and for tractioning out all the fascia that runs down the spine. So I'm gonna grab behind my neck, I'm gripping the skin, and I'm pulling up and holding. And I'm gonna try and keep this grip on the neck. And then once I'm here, I'm gonna inhale and center, twist to one side, exhale, come back to center. Inhale, twist to the other side, exhale, back to center. We're gonna do 2 more sets. So twist, come back, inhale, twist, exhale, center. 1 more each side. All right, keep holding. And from here, I'm gonna go into like a skier squat. My head and my heart are lifted. And I'm gonna do the same thing here. I'm gonna inhale, center, twist to one side, exhale, down. Inhale, twist, exhale, down. Notice if you feel the pressure shifting in your body. A couple more rounds here. Last set each side. Okay, now I'm gonna squat all the way down as far as I can. If you can't go all the way down, go as low as you can. I'm gonna curl my elbows in. Round and squat. Stay here and breathe for a few rounds. Keep squeezing your neck. And then slowly, gently, I'm gonna straighten my legs. Forward fold, drop the head. Stay here and hang. And then really slowly, I'm gonna unfurl. Like a fern, come back up. Keep squeezing the head. And then once I'm at the top, slowly, gently, release the hands. Feel how your temperature shifted. Walk around a little bit if you have space. Okay, so after those first 2, let's have a little check-in about how those felt for you guys. Did you feel your temperature shift? Okay, let's scroll. Let me scroll down here on the chat. Yeah, okay. And so part of these fascial maneuvers is that we are a pressurized system, which is great because otherwise we would collapse, right? We have gravity weighing down on us. So we are a pressurized vessel. In Eastern medicine, we call it the 3 vessels. So we have the first vessel is the cranial vessel. So from the palate to the skull. The second vessel is from the palate down to the diaphragm. So that's our respiratory vessel. The third vessel is our lower organ quadrant from the diaphragm to the pelvic floor. So one example recently from a client who had given birth, when she sneezes, she also farts, right? So when the pressure from one area shifts, it shifts elsewhere. Another example that I had was a client came in and they were really frustrated in their romantic relationship and they felt like they really needed to leave, right? Or needed to make a move. But once we did the fascial work and shifted the internal pressure, that released, right? So we can sometimes feel like the pressure internally and it comes out externally. I sometimes feel that as like wanting to snap at someone, right? Like our bucket's full and it's just, we've just had too much, right? So the energy can come out different ways. Another way that it comes out is in the joints, because that's where a lot of our movement happens. That's why we blow out a shoulder, we blow out our knee, why we typically have joint replacement happen. Okay, so next on our list is swinger. So this is great. Typically we would call it tennis elbow, golfer's elbow. I would call it gardening elbow, crafting elbow. So you can do this one seated as well. So we're gonna bring the arm up. We're gonna take the other hand and grab the elbow. If I can get to skin, that's great. We can get a little bit more contact. I might lick my fingers to get a little traction. And I'm spinning the elbow. It can go either direction, however it kind of works for your body. And then I'm gonna try and lift it up as much as possible. And then I'm gonna lean to the side. Yeah, and then I'm gonna try and turn my head up. And I'm gonna breathe. So a few rounds through the nose. And then a few rounds through the mouth. Okay, slowly, gently unwind. Wiggle out the head a little bit. Okay, let's stay on this side. So we did swinger, which is an advancement of the elbow torque, which is a little bit further down the list. So let's do twisty wristy. I'm just gonna do the arm stuff with you guys, but we can do the same thing on our legs. It's just a little bit awkward via Zoom, but it's out there and the videos are there for you to watch too. So twisty wristy. I'm gonna grab where my watch or my bracelet would be. I'm gonna spin the hand that's grabbing one way and I'm turning the wrist the other way. Okay, and then I'm gonna wiggle my fingers a little bit. So it's sort of like a pin and stretch is another phrase that I would call it. Okay, and then I'm gonna reach my arm out. I'm gonna try and move it around all the different directions. Breathe. So we're trying to stay for at least 6 rounds of breath if we have the time. This staying is where we really start to get the fascial release. Okay, come back to center, release that side, feel the difference from side to side. Okay, so that's a great one. You can do this in a meeting. You're not gonna look too weird. Okay, so we did elbow torque. Let's go to the more simpler elbow torque. Arms coming out, same thing. We're just twisting and holding. So once we pin here, we're adding more pressure so that through this arm fascial system, something needs to shift as we breathe. In the nervous system, we call it the long latency response. So we have fast twitch muscles, we have slow twitch muscles, and the fascia is slow. So we want to slowly and gently melt it. Okay, nice and easy. Let that go. Roll out the shoulders. The last one for the arms is the arm pull. So we can do it on ourselves. We could also do it with a partner. So what we did with the wrist, that twisty motion, I'm going to come up above my elbow and I'm going to squeeze in my bicep, tricep. And then I'm going to spin that arm out. I'm going to reach this arm down towards the floor. The bottom half, I'm going to imagine like I'm sliding my fingers into gloves. So bottom half of the arm's trying to reach down. We're holding with this other hand. Then the shoulders gonna try and come up towards our neck. So we're kind of pulling in all directions. Okay, keep spinning out with that arm that's squeezing as much as you can tolerate. Breathe. Okay, and then slowly, gently, let it go. Shake it out. Feel the difference from side to side. Okay, let's a little bit more quickly go through the other side just so we don't leave that side neglected. So twisty wristy, grab at the wrist, squeeze as much as you can tolerate, turn in opposite directions, wiggle the fingers. And this is a big one. We use our fingers for so much, so we really want to keep those free and easy to move. So this is working on the carpal tunnel. Okay, and then I'm gonna do a little movement. Move around, move up and down. Right, and then slowly, gently, let it go. Shake it out, let that energy move. Okay, we're going to the elbow torque. Elbow comes up. Grab the skin, twist and try and hold. Move the elbow around. We're gonna do this, we're gonna move right into pullover. So if I can, lift it up, turn the head up towards that elbow, lean to the side, breathe into the side body, breathe into the rib cage. Slow, gentle movement, unsticking that stuff. You might feel it go down your back, maybe back into the kidneys. Good. Slowly, gently unwind. Let it go. Roll out the shoulders. Take a couple rounds of breath. Okay, last one. Arm pull. Grab your upper arm. Spin it out. Hand tries to go down into a glove. Shoulder tries to come up to the ear. So we're adding these levels of engagement. Okay, head moves a little bit, chin moves. Maybe you roll your eyes behind your eyelids, move your tongue around a little bit. 2 more deep breaths here. And then really gently let that go. Shake it out. Okay, so it can move a lot of energy. Some of us know the book, The Body Keeps the Score, right? So there's a lot of things that the body processes that we are not aware of in our conscious awareness. So the physical body can really only keep track of the 3 top priorities at a time. So we're trying to start to cross some of those things off our physical to-do list so that we can start to get into the more subtle stuff. So I can imagine in the work that you guys are doing, right, we start to find these little pieces that have gotten tucked away. So I like to call it the junk drawers of the body, where the body is really tricky and it can hide this stuff. Okay, so let's move into the face now. So if you have clean hands, we're gonna do palate swipe. So part of the compression that happens in the brain is through our birth process, and or just, you know, efforting through life, right? Like biting in our jaw. So if I have clean hands, I'm gonna palate swipe from right to left 5 times. and then breathe and notice how that feels. So that's another one of the really easy fascial maneuvers that you can do in the shower when you brush your teeth that starts to shift this top of the vessel. Okay, so next for the face is the ear pull. So this is another one that you can kind of do out in public and you're not gonna look too crazy. So we're gonna just gently massage around the ear. I'm gently pulling down, and as I work my way up the ear, I'm pulling back. And then once I get on top, I'm pulling up. So the temporal lobe is so crucial. That's kind of where all the nerves come out into the rest of the body. From the School of Reflexology, the ear has all the body points. So again, this is an easy one to kind of just get everything. Okay, you might feel the temperature shift in your ear. Okay, and then gently when you're ready, let that go. Okay, the next one is called antler twist. So I've got my hands going in opposite directions. I'm gonna come right at the top of my jawbone, outside my eyelids. Yep, and you could try it going either way. And then from here, I'm rotating my fingers up to the sky. Woo! Yep, and so this is where we get our antlers. And then I'm gonna try and remember to breathe. I'm gonna move my head around. This is a fun one to do if you have kids of any age, friends who are playful and curious. Okay, back to center, let that go, breathe, circle the head out a little bit. Okay, the next one's kind of similar, and it's for the sinuses. So I'm taking one set of fingers around my nose, over to the side of my nose on the other side. Then this hand is going backwards, and it's gonna press the cheek jaw away. And then I'm gonna breathe. So this is good if you have allergies, if you're congested, open the ear, nose, throat pathway. And again, deep breath. And then slowly, gently let that go. Let's do the ear on the other side quickly. Again, if we have time, we want to take 6 rounds of breath. So pulling down, pulling back. You can circle. You can try and get that fascia moving. With the skull, the analogy that I like is the idea that we have an orange and we're trying to wrap it in 10 sheets of wrapping paper. And so there's somewhere where that wrapping paper has to fold a little bit. And so usually that's around the occiput base of the neck. Okay, when you're ready, let that go. Let that energy move. We're doing now sinuses on the other side. So fingers hook, hand tractions that skin back. Keep breathing. Okay, nice and easy. Let that go. Okay, the next one is for the thyroid, for the vagus nerve. We're gently gonna imagine, we're gonna come to like the Adam's apple area of the neck, and then we're slowly, gently gonna pull the hands apart. And then connect with that smooth, steady, deep breath. Okay, and then nice and easy, let that go. Okay, let's have a little check-in. So, yeah, yawning is part of the body trying to get more oxygen in to help integrate that processing. Yeah, and so we also notice it as heat, right? So that energy starts to shift and releases out of our body as heat. So heat is normal, shaking is normal, yawning, burping, farting is normal. So like releasing the pressure out of the system. Okay, so the next set of things that we're gonna do is torques in the belly. So we're gonna do belly, solar plexus, and bladder torque. And we could have a month workshop on all of this stuff, right? And the connection with the chakras, the meridians, the energy points. There are also tools that they sell, and I recommend finding the least expensive one to invest in. So I have a little half circle plastic ball that I use. It's hard to do this on ourselves. So it's good if you find a community on the Human Garage forum where you can practice with other people. So for these torques, we're gonna start with the belly. I am starting with my palm up and kind of turning it in with my palm up so that then when I turn, my thumb's gonna go up to the sky. So I'm going into the belly and then I'm turning up, and it's uncomfortable. So I'm gonna stay here and then breathe. So palm up and then turn your thumb up to the sky if you can. You could also make a fist and turn. I might use a tennis ball. Yeah. So lots of things, right? The nerves that come through the belly, through the diaphragm, down into the rest of the body. So this can get tight from just our normal daily posture. This can get tight from car accidents, other injuries, pregnancy, birth. Okay, slowly, gently, let that go. And then I would do maybe a little movement. Okay, so same thing at the solar plexus. The solar plexus, go right below the belly button, palm up, and then turn your thumb to the sky. If that hand gets tired, you can always switch hands, turn the other way, reconnect with that breath, 6 rounds of breath, 3 in and out through the nose. And here we can notice, where does that nose breath go into our body? And then as we shift in and out through the mouth, can I feel that bigger mouth breath come deeper down into the diaphragm, into the belly? Okay, slowly, gently, let that go. Okay, last one is in the bladder. And so I'm gonna find my pubic bone. I'm gonna come up just a little bit. It kind of helps me standing to kind of bend forward so it softens in the belly a little bit. Yeah, painful. It's okay. It can be a little bit uncomfortable. Then I'm going to stand up and then I'm turning, thumb up to the sky. So bladder, keep breathing. Bladder's a curious one in terms of the meridians because it has 2 lines along the spine on both sides. So different than just the 1 meridian line on each side. So it's a really powerful one for us. And we see this when we're traveling and we can't go pee or poop because our body's uncomfortable. Okay, slowly, gently, let that one go. All right, good job. So let's have a little check in there. And just remember, this is a lot. Like, I typically wouldn't do all of this, right? But we're deep diving here today, and then try and see which ones you want to integrate. Any questions out there so far? No. Okay. And as this integrates through the rest of the day, as we start to maybe weave this practice in, you can always message me. We can always just stay connected for like how it starts to then impact our life. Okay, so we are already at the organ reset piece. And so this is the most subtle of the maneuvers, but also the most powerful. So if we have all of our organ systems operating at their potential, it helps us move out of dis-ease, right? If everything's easy, connected, flowing, that helps our system stay balanced. So the most popular one is HeartMath Institute, right? So they have this like that the heart is the stronger energetic frequency that can shift our experience. But we have all these other organs that are equally as important. Okay, so what we normally start with is one hand on the head, one hand on the heart. And we're imagining breathing here, connecting those two things so that we can find that balance. So as we inhale, awareness goes up to the crown of the head. As we exhale, we follow that exhale into the hand that's on our heart. And then we inhale into the heart expands, sending that loving presence up to the brain, thanking the brain for all of the amazing work that it does for us. Connecting the two, moving the energy through the throat chakra, letting go of those times where we didn't speak up, didn't speak our truth, didn't know what to say. Okay, so just connecting this pathway so that we can use both of these important information channels to help us move through our life. Okay, slowly, gently, we're gonna let that go. Okay, and then we're gonna bring one hand to the back of the neck. So this is keeping that connection open. If it's hard for you to get your arm back here, you can always just go front of the throat. And you can always feel free to shift as we go through our practice. Okay, so the next one that we're gonna do is the ileocecal valve. So find your belly button. Go 2 inches to the right. I know on video I can't mirror you. 2 inches to the right, 2 inches down, or otherwise I draw a diagonal line from my belly button to my hip. So once you're there, you're gonna be in the right space. So again, I'm pushing in as much as I can tolerate, and then I'm finding the breath. And energetically, I'm drawing a line. As I inhale into my belly, I let my belly expand, Buddha belly. Exhale, let that energy go up to the hand, up through the head. Inhale down into those lower fingers, lower hand. This is the valve between the large intestine and the small intestine. So it might feel a little icky, a little nauseating, maybe. Okay, one more round of breath here. Okay, and then gently let it go, move around a little bit. Yeah, good. I love seeing those yawns. That means the stuff is moving. Okay, so hand comes back up. We might change hands, okay? Left hand, belly button 2 inches over, 2 inches up. We're going into the stomach. Yeah, woo. And so this is something that we could just, work our way through the belly to connect to the organs, try and unstick that fascia. Breathe. Yep, our face is our cue, right? It's like, ooh, too much, soften a little bit. Inhale through the nose, strong exhale, let it go. One more breath here. Okay, let that relax. Okay, next one is the liver. So left hand's coming to the neck. Right hand's finding the belly button. It's going 2 inches over, and now this time 2 inches up. So over and up to the right. Okay, so stomach's here, liver, gallbladder's here on the right side. Okay, and then breathing. So again, trying to draw that line, which is not imaginary, from upper hand down to the lower hand. Clearing that pathway all the way up through the throat, through the heart. 2 more rounds of breath. Okay, gently let that go. Take a break. Okay, the next two that we're gonna do, well, we have one more. We have Valve of Houston on the left side. So right hand's gonna come to the neck. Left hand's coming to the belly button. 2 inches to the left, 2 inches down. Again, it might feel spot, right? So that means we're kind of on the right place. If you start to feel your pulse, your heartbeat through that nerve, you can move out a little bit more to the left. So find that smooth, steady breath. Okay, gently let that go. Okay, the next two that we're gonna do are the kidneys. So this is sort of on the side, on the back body. So I'm bringing whatever side hand I'm doing, I'm finding my lower ribs kind of right up on the side there. My thumb's wrapping around to the back body, and then my other hand is coming to the neck. And then really try and get that inhale into that lower hand. You could also lean to the side to help it open a little bit. Okay, gently let that side go. Coming to the other side. Last one. So hand on the neck, other hand wraps around, thumbs going to the back of the rib cage. I'm sort of leaning to the side here, maybe leaning a little bit forward to get my breath into the thumb, down into those lower ribs. Good, 2 more rounds of breath. Okay, slowly, gently, let that go. Okay. All right, we have 2 more standing postures that we're gonna do. So this should kind of help all that energy we got moving, move it through the system. Okay, so the first one that we're gonna do is called swinger. Okay, so I know you can't see my feet, but I have one foot pointing to the camera. The other foot's gonna turn at a 90-degree angle. And then that foot that's turned is gonna step about 3 feet out. So I'm coming into like a goddess stance, but the other knee is turned out. Okay, that opposite hand, so my right leg is out. My left hand's gonna reach forward, and then it's coming to my shoulder. My other hand's gonna come up and grab the elbow. I'm gonna squat down a little bit more. I'm turning that elbow towards my knee. Yeah, and then I'm gonna turn my head and look up to the sky. And then I'm gonna reconnect with that breath. In and out through the nose a few times. Good, and then in and out through the mouth. Okay, slowly, gently, come back to center. Step it in, walk it out. We're coming to the other side. Okay, so feet turn, step about 3 feet, bend into the knees. Other hand is like I'm going to shake hands. I reach it forward, bring it to the opposite shoulder. That hand comes up and grabs the elbow. Twist to the side towards that bent knee. Okay, good. And then turn your head towards the other shoulder. Look up. In and out through the nose. Beautiful. 2 more. And then through the mouth 3 times. We're almost there. You're doing an amazing job. That's it. Slow, slow, slow. Unwind, come up. Walk it in. Last one. Great job. Okay, so pretzel squat. Similar, I'm gonna squat down. One hand's coming to the shoulder, the other hand is half binding behind my back. I'm gonna turn towards that front arm, so look over that shoulder. Find 3 rounds of breath here. Squat down a little bit more. Okay, and then I'm coming up and I'm switching arms. So squat down, turn, look over that shoulder. Last 3 rounds of breath in and out through the mouth. That's it. Slowly, gently come up. Shake it out. The last little integrating piece we're going to do is what we call fascial coffee. So they say, like, while you're making your coffee in the morning, you can do this, or I like to do it when I'm in the shower. So it's also a lymph flow. So it's like dry brushing. So we're just gently coming up the arm. So we're always going towards the heart. So up the inside of the arm, up the outside of the arm 3 times, switching arms. So waking up all those meridians, all those nerve endings at the skin, up the back side of the arm. Okay, and then from the feet, up the insides of the legs to the groin, 3 times in the inner thighs. And then to the outside, up the outer edge, the peroneals, the IT band around those hips. Last time, and then we're going to the backs of the legs. So however it works for your body, either you reach inside or you reach around the outside, up to the booty. And then up and around the belly, around the chest, up and over the head, down the back. And that's it. That's it for the physical piece of it. Okay, so that's one way that we help treat the body, is through these physical practices. The other 2 things that I want to just briefly mention is water and minerals. So water is so important. So having clean water, having a water filter. There's also apps out there that post where there's free springs. So that's what I do. I go get spring water every month. The other piece of it is the water that we're using when we shower or bathe. So that's one thing where I don't know, I'm a hippie. I thought I had it all. But only last year, I finally got a shower head that has a filter. And so I actually sent you guys the shower head itself, but I didn't post the filter. So I'll try and post that. But just a chlorine fluoride filter that attaches to in between the shower head that you already have and the wall. Mary, will you unmute yourself? And then I'll see if I can, yes, you can do your ears at the same time. Absolutely. Okay.
So that was incredible. First, let me just start off with, whoa, my back feels so much looser, my shoulders. Does everybody else? Like, I would love to hear, like, people are nodding. Please unmute and share with Amber. I know, I couldn't stop yawning, Susan. Does anybody want to share?
I can share. This is so perfect. I've been walking my dog a lot, and I have old shoes, and my hips started hurting, and so I've been looking for something like this, and so this is awesome. Moving the the leg rub. I don't do that, and just doing it, it felt really good. So thank you.
You're welcome.
Kind of felt almost like a rush, like blood just kind of flowing more after we did a lot of the up and then run them down. Just like warm.
Yeah, so it's sort of like a garden hose, right? When we pinch off the garden hose and then when we open it up, right, all that energy gets to move.
So who do you recommend this for, Amber? Like, you know, who comes to see you? Because I'm gonna tell you, like, I still feel like I have an SSI joint, and after doing today, I'm like, it feels agile.
Yeah.
But it's not just for aches and pains. I know that. That's why I want to make sure everybody knows.
Yeah, well, and part of it is like we don't know that we don't feel great until we feel better, because that's the body's amazing ability to tolerate and get used to coping with things. And so this is a gentle thing that we can integrate to start to free up more of that energy to feel better, to focus on more of the things that we love. So to start to allow more and more feeling better. So I know a lot of people, you know, now and always throughout time, right? We're just trying to survive. We're trying to make it through. We're trying to take care of all the things on our to-do list. And so this can start to help us from inside out shift things. Yeah, and with the palate exercise, I love that. As, you know, a massage therapist, one of the things I do with people is interoral jaw work. So some of the other things we can do is like go around. Each tooth has a different nerve that attaches to it. So we can like, you know, go around in our jaw. And the jaw's somewhere that's like out of sight, right? It's below and behind our eyeballs. And we kind of take it for granted. And we see in modern medicine, right? There's all of medicine and then the dentist is over here. And like, so things we can do for ourselves to go around. Another one I love is called the lateral pterygoids. And so it's right up in here. It's kind of our little chipmunk spot. So we can always come to it from the outside and just massage, you know, right in the meaty part of our cheek, or I can go up and in with my finger and just hold that spot. And that's where I get the most profound response from the people that are open to doing that deep work of like, I feel like a different person. Yeah.
Palette was amazing. I mean, I had to like go off, I put my camera on so I could go to the bathroom, and I came back and I was worried I wouldn't feel the effects, and almost immediately I started to feel differently once I jumped in and did the exercises. I can't believe how fast that was. But the palette, if you did it, everyone, I don't know what happened for you, but for me it was just like I could feel like a rush of whatever I activated. That was trippy.
Yeah, and so the jaw is one of those pieces that connects with the parasympathetic nervous system. So moving us out of fight or flight into rest, digest, and relax. So rest, yawning, digest, chewing, relax, laughing. So anything that kind of gets our mouth to open.
So what I noticed today was I was touching the psoas, and it kind of felt like, I don't know if you've done, yeah, I mean, I know you do, because you're, it's like you do many things, but I noticed how tight my psoas was, and especially when we were digging into certain places and I was trying to find, and the psoas is really interesting because that's a muscle that automatically, like, you know, at least my massage therapist was teaching me that that's a muscle that was trained by, you know, it's a fight or flight response, and it can stay stuck and tight, which could cause some of the back pain, and, you know, and then, you know, so she was talking to me about doing some jaw exercises, so I just, the two areas that I can feel the tightness in, it just totally helped me. So, yeah, I'm like,
Beautiful.
I'm amazed.
Yeah, and it will keep unfolding.
So Susan, definitely try it when you have flu fevers. So what can we expect? So now we've done this, you know, what is the protocol, you know, like what's the regimen, or, you know, how, like, should, you know, I definitely put your link in the chat, put your website, but how can people book with you if they want to do like a one-to-one session with you, release the fascia?
Yeah. Well, I'm always down to do one-on-one coaching, but also if you guys have this cohort that has been working together and we want to do like a group thing, and it's, I mean, I love how it all starts to weave together. So hopefully, you know, it's not just another tool in this overflowing toolbox, right? It's something that we can really integrate. And if I would say if you have injuries that haven't resolved, this is an approach that can kind of target those things. So sometimes we go for massage, we go to physical therapy, and it just doesn't quite get it because we're not targeting just the muscles, just the tendons, right? It's this whole system that is woven through the body. Also, the app is great, you know, so the app is free. They have these resets. They're also educating you in the process. So that's the piece where giving yourself that time, staying as consistent as you want. You know, to be honest, I don't do human garage maneuvers every day. I probably do them every 2 or 3 days along with my yoga and my other movement practices.
Does anybody want to share? Is your body fuzzy? Is it just that I'm responding so well to human garage, but I'm like, I can feel my body kind of fuzzy? Well, okay, so how can people work with you, Amber?
Yeah, so I work with people in person or online via Zoom. I always love, you know, we can do just human garage coaching. I love that, but I also love integrating Feldenkrais. Is another one that has been really helpful for me. So just a little backside piece. I was in the military for 10 years and I had a back injury from repetitive motion from throwing my rucksack on and also having to be in this not ideal environment for a female and for my nervous system. And so my back would go out. I couldn't walk. I couldn't do massage. I couldn't do anything. So a combination of Feldenkrais and Edu, which is another spinal movement practice that I teach, were the things that made me, you know, 90% better. So kind of working with people in a way that like we create it just for you to help you get the results that you need because everybody's different. And so that's the fun part of being a shaman and working with that intuitive piece of like, we have the structure, right? And I'm happy to give you the structure so you know how to operate. And then once we know the recipe, we kind of dance within that in a way that it works into all the levels and layers of our being.
Love it. Does anybody have questions for Amber? And I want to make sure everybody follows her. I put her links in the chat, so please follow her. If you are on Instagram and Facebook, please make sure to connect with Amber. But does anybody have any questions? I know somebody has a question.
Yeah, I'll also post in here, I love Strolling Under the Skin is an old video about fascia that's on YouTube. But there's just so much that we're finding out about it. So it's one of these things like stay tuned in to what starts to come out around the fascia.
Yeah, I'm starting to see more and more videos like on Instagram and YouTube on fascia release, and so I'm like, wow, this is the new thing that's happening, and yeah, and I feel differently in my body. Yeah, I don't want to. If anybody else would like to share
Yeah, so April asked how often. And you know, the thing is, it's, you can do like a 15 minutes. So if I was doing my normal daily practice, I would do totally twisted and anti-gravity. Those are the two, right? Where it's getting most, so that's maybe a 10-minute practice. So instead of it needing to be this hour-long thing, so that makes it a little bit more accessible. Ideally, if you can do it every day, yeah, that's great, because it helps us kind of like process this backlog of stuff. So once we've been consistent and we've kind of emptied this old bucket, and then we deal with the daily things. So I think about it like talking about therapists. I need one therapist for my past stuff, and I need one therapist for like what's currently going on. So it's like after we have like dealt with that past stuff, hopefully that frees us up so that it's easier to just maintain.
Michelle, did you have a question? But you had unmuted.
I was just gonna mention that years ago, because I had so much pain and my doctor couldn't figure it out, and he actually talked about finding someone that does fascia work. And the massage therapist that I had at the time had no idea even like really it was really, you know, talking about, you know, they just were doing regular, you know, massage. And so yeah, I mean, it's great that it's coming out, and that was really awesome. And I've always seen the Human Garage stuff, and I thought it was fascinating. So
Yeah, thanks for sharing. Yeah, it's great to see it finally get more into the mainstream. Okay, well, I'm always here if you have questions come up. You can send them through Mary Lou. You can reach out to me directly. And, you know, it's just here to share the teachings, here to share your experiences, how it supports you, and then to share it with your friends and family.
Well, April, I'm so glad you hopped on. She said, I've been following the Human Garage for a while, but it seems so overwhelming. I didn't know where to start. So, Amber, I mean, I'm really grateful that you came and basically walked us through a whole, I mean, I know it was the accelerated.
Yeah.
But I'm going to tell you, it felt really good. I'm so grateful to you for sharing your expertise with us.
Yeah, thanks for posting that too, because I just taught a workshop in Corvallis with a group of people. Same thing. They've heard about the Human Garage, but if that barrier to entry and experience, and then being like, okay, I feel a lot more comfortable doing it by myself, going back to the videos.
Amber, do you work with people that have chronic pain, like from Lyme disease?
Yeah, all sorts of chronic pain. And so Lyme disease, some of these other, you know, where it's like, it's hard to pinpoint, right? So this helps all the fascial system and the nervous system really move out of that fight or flight so that it can start to shift and feel safe enough to move out of that pattern.
So is that something that you can help with coaching, or is it better for hands-on? Because my stepson is in Minneapolis. So.
Yeah, happy to do it via Zoom.
Okay.
Yeah.
All right, I'll let him know.
Great.
Thank you.
You're welcome.
Yes, did you have any, there's a few people here who did the question. Do you have anything coming up? So Amber's in Eugene.
I don't at the moment, but I love it, and having the impetus to put something on the schedule, to create a couple more like online offerings. Yeah, so I'll send you an update about that.
So amazing. No, thank you again, Amber, for coming and hanging out with us. And I know that Amber, like my interest was in Human Garage initially because I was like the trauma in my fascia. Like I just had never heard of that before in that way. I mean, I knew it was in the body, but I didn't understand really what the fascia was. So it led me down this whole rabbit hole of wanting to learn more, and that's why I wanted to bring her into the group, was so that everybody could experience, you know. And I did download their app, and I did do some YouTube videos, and so yeah, I just want to say thank you so much.
You're welcome.
Well, that's it, everybody.
Okay, thanks.
Bye.
Bye.
The recording has stopped.